If you've been stretching endlessly with no relief from sacroiliac joint or SI joint pain, you're not alone. There's a reason why it isn't working, and the solution might be simpler than you think. SI joint dysfunction and pelvic misalignments are common, and yet many people are stuck in pain stretching endlessly without seeing any improvement. The good news? You don't need surgery, painkillers, or complicated solutions. Chiropractic adjustments can provide fast, safe, and effective relief for your SI joint pain, correcting misalignments that could be the root cause of your pain. Thousands of people have found relief through chiropractic care for SI joint dysfunction, and I'm here to show you how. People just like you who have tried stretching, physical therapy, and even medications are now pain-free thanks to simple and specific chiropractic adjustments. By the end of this video, you'll understand the real cause of SI joint pain and why stretching alone might not be the solution, and how a simple chiropractic adjustments can realign the pelvis and eliminate SI joint pain. Chiropractic care goes beyond masking symptoms. It corrects the root cause of SI joint pain safely and quickly without drugs or surgery. Stay to the end of the video and I'll show you a demonstration of different adjustment techniques so you know how the SI joint can be adjusted. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas, and for over 15 years I've been helping patients overcome chronic lower back pain, sciatica, and neck pain, all without medication, using specific chiropractic techniques. If you're busy with work or home life and dealing with chronic spinal conditions, this channel is dedicated to helping you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so that you can stay healthy and pain-free. Before we dive in, subscribe to my channel if you want tips and strategies to help you achieve lasting relief without relying on medications or surgery. So before I show you how I would adjust the SI joint as a chiropractor, let's first talk about the spinal anatomy and what the SI joint is. Now this would be us looking at you from behind. So we have the pelvis, which each hip bone is known as the ilium. We have the sacrum, which is part of the tailbone in the center. And then we have bones in the lower back. We have discs in between each bone, and then we have nerves that come out on both sides of the spine and nerves that come out on both sides of the SI joint. Now, ideally, if I was looking at you from behind, the pelvis would be in an even position. But a lot of times as chiropractors, what we see is the pelvis will shift or it will rotate in one position or another. When the pelvis shifts out of position, it starts to put pressure onto nerves, and that's what leads to SI joint pain. So as chiropractors, what we do is use our hands to push these back into position to help relieve the pressure off the nerve, help get the SI joint moving properly, help relieve pain. Now we also have muscles that attach at the pelvis and SI joint. Your glute muscles attach on either side of the ilium, and your hamstrings attach at the base of the ilium. So when your glutes or hamstrings become tight, this happens a lot due to a lot of my patients that sit in front of computers all day. When those two muscle groups get tight, they start to pull the pelvis out of position, which can cause SI joint pain. So in addition to putting the pelvis back into a proper position through chiropractic adjustments, it's also important that we stretch and strengthen the glutes and the hamstrings in order to keep the SI joints healthy and in a better position. As you can see, the anatomy of the SI joint is quite complex, and both the joint and the surrounding tissues are a major source of pain. This is why simply stretching tight muscles in the lower backs, buttocks, and hips often isn't enough to help relieve discomfort. A thorough assessment of the spine and pelvis is essential for identifying the root cause of SI joint pain. Misalignments in the spine, pelvis, leg length discrepancies, and poor posture can all create structural stress in the SI joint, leading to pain. This is where chiropractic comes in. A chiropractor focuses on identifying spinal and pelvic misalignments as well as postural distortions through physical examination and often X-ray analysis. Once misalignments in the sacrum or pelvis are found, specific chiropractic adjustments are applied to correct biomechanical stress on the SI joint. This correction kickstarts the healing process as the SI joint functions more effectively, spinal and postural alignment improve, which relieves stress on the SI joint. Inflammation will also start to decrease, which relieves pain. In a moment, I will demonstrate chiropractic adjustments to the sacrum and the SI joint, so stay with me. Through adjustments, we've helped hundreds of patients eliminate SI joint pain and return to a normal, pain-free life. Follow me, and I'll show you what these adjustments look like. Okay, so now I'm going to demonstrate the two most common ways I would adjust the SI joint in my office. Now, before I would perform any of these adjustments, at a bar minimum, I would always do a full consultation and physical examination of the spine just to make sure I knew exactly that the pain was coming from the SI joint. And in almost all cases, I would always do x-rays as well. We have a software we can measure the sacrum, we can measure the ilium, and I can determine the exact bones that need to be moved in order to relieve SI joint pain. Now the first adjustment I'm going to show you is going to be using a drop piece. Now this is a great way to adjust people that might be a little bit older, who might have osteopenia, some brittle bones, or if people are scared of hearing pops and cracks. This is a way we can be really specific on the sacrum or on the ilium and know exactly what we're moving. So the first thing I'll do is I'm going to assess the leg length. So as I'm checking leg length here, I can tell her right leg is about 1/4 inch shorter than the left. When I come up and I apply pressure to the right ilium, and I'm going to come back and check, and her leg length is better now. So that tells me her SI joint on the right needs to be adjusted on the right ilium. And as I'm applying pressure to the sacrum here, I can tell that the sacrum on the left isn't quite moving, so we're going to adjust the left sacrum using a drop piece. So I'm going to pull the lever here underneath the table. It's going to pop up underneath her. I'm just going to loosen it until it falls. And then all I'll do is just apply a light force onto the left side of that sacrum until the table drops. Usually do that a couple of times. Come back and check, and that's better. So that's the first adjustment for the drop piece on the sacrum. The second adjustment I'm going to show is going to be a side posture. Now this is one where you hear pops and cracks. Sometimes it can be a little bit more effective than the drop piece in some cases, but it's really good to help adjust the ilium. So what I'll have you do is let's lay on your side, on your left hip, your right side up, please. To perform this adjustment, I'll have the patient lay on their sides. We're going to bend the top leg here and keep the bottom leg straight. Pull the arm out to on your shoulder, and let's scoot your hip just a little bit closer towards me. And then what I do is I'm going to contact her shoulder or her elbow just to help get some traction. And my hand is going to be right on the ilium on the right side. I'm just going to gently roll her towards me, and I'm going to apply a pressure with that left hand. Just like that. Perfect. That's the way we can adjust the SI joint on the right side, just to help relieve nerve pressure, get her mobility back to normal, and help relieve SI joint pain. While stretching and exercise can play an important role in relieving SI joint pain, they often only address the surface symptoms, not the actual cause. If your SI joint pain isn't improving, what may be missing is a thorough assessment and correction of spinal and pelvic misalignments. Stretching alone can't fix a structural issue like SI joint dysfunction. Chiropractic adjustments target the root cause of SI joint pain by realigning the pelvis and reducing pressure on the SI joints, offering safe, drug-free, and non-invasive solution to correct the problem at its source. If you've been struggling with SI joint pain, it's time to consider chiropractic care as the answer to long-lasting relief. If you found value in this video below, be sure to like it and share it with others who may benefit. Also, feel free to leave a comment or a question below. I'd love to hear from you. And don't forget to subscribe to my channel for more tips and strategies to help achieve lasting relief, improve your mobility, and regain control of your life without relying on medication or surgery. In the meantime, if you want to get started with some home-based exercises for SI joint pain, this video is the one you should watch next.